as ischioanal. Okay, ischioanal space or ischiorectal space. It is between ischium, which forms the lateral wall of the pelvis, okay, and medially you have the rectum and anal canal. So whatever the space between them is called as the ischiorectal space, okay, or even called as the fossa, as it is closed on all the sides. So in this picture you can make out this is what is the ischium, okay, the bone ischium, okay, this is the rectum and anal canal, and this is the pelvic diaphragm, or the levatrinium of the pelvic diaphragm. So below the pelvic diaphragm, between the rectum, anal canal and the ischium is the space, which is a bigger space, roughly about 5 to 6 centimeter from anterior to posterior side, okay, and 2.5 centimeter from side to side, okay. So that is the measurement of the ischiorectal space, or also called the ischioanal space. So you can say it's almost like a wedge shape or cone shape like this, okay. The base is formed by the skin, okay, the base is formed by the skin, and then apex is towards upper side, where it is formed by the meeting of this fascia covering the pelvic diaphragm and the ischium bone. So this forms the apex and this forms the skin base. Okay, this is what is the anal orifice. You to understand, the skin of the buttock. Skin of the butt forms the base. Okay, so this is the space usually filled with large amount of fat, loose alveolar tissue, and you have the loosely lobulated fat, which is the main content of the ischiorectal fossa. Okay. So what is the content, main content? It is the fat. It is the fat. So this space becomes clinically important. Why it becomes clinically important? Because of its location nearer to the anal orifice, and the content is much fat, and the poor blood supply. As it is mainly filled with fat, so the blood supply will be less. So poor blood supply and containing the fat and proximity to the anal orifice makes this space vulnerable for infections. So as this anal orifice is there, where they have the passage of the stools and all, so which is bacterially contaminated. So if we don't keep the hygiene of that area properly, there is chance of infection from this bacteria spreading to the ischiorectal space and causing abscess. As it is poorly supplied with blood, so less blood supply, more fat, okay, what happens? The fat is mainly, it's like the rich food for bacteria to grow, and less blood supply means lesser immunity. So immunity is through the blood, right? So when the blood is less, so immunity is less. So fat is there, it acts the food for the bacteria to grow, so that the abscesses are common. Abscesses are common in this area, that's why it becomes important clinically. Clear? So that abscess may break through this wall of the rectum and open into the rectum, forming fistulas. What is that? Anal fistulas. The abscess here can break open here and then open into fistula. So continuously bacteria spread here, abscess formed, abscess is drained through, then orifice, so cycle. So they don't, even if you give n number of antibiotics, the abscess or the fistula is not cured. So you have to treat it surgically. You have to go for closure of this communication, okay, and then give the antibiotic, clean the abscess from this space, then you go for healing. Am I clear? So that's why this space has become important, which are present on either side of the anal canal. Am I clear? Okay. So as I said, it is having boundaries. It is having medial boundary, it is having lateral boundary, it is posteriorly bounded, anteriorly bounded, and lower also it is bounded. So what is medially? What is the medial boundary? It is formed by the wall of the rectum and anal canal, covered by the sphincters. What is there in the lateral? What is the lateral boundary? The ischium covered by the obturator, internus muscle, and its fascia forms the lateral boundary. What is posterior? Posterior what? The sacrum and the ischiotubral, that is a ligament between sacrum and the ischiotubus, sacrotuberous and sacrospinous ligaments. They form the posterior boundary. So anteriorly it is slightly, there is recess, it may extend up to the pubic bones. Okay, or anteriorly it is bounded by, what is that? Perineal membrane. Okay, so lower side what you have? The skin, which forms the base. Clear? What is above? It is by the pelvic diaphragm. Am I clear? Need to get the three-dimensional picture. Okay, so above you have the pelvic diaphragm, below you have the skin, medially you have the wall of the rectum and anal canal, laterally you have the ischium covered by obturator internus muscle, above you have the pelvic diaphragm. Clear? Posteriorly the ligaments. What ligaments? Sacrotuberous and sacrospinous ligaments. Anteriorly you have the perineum. So these forms the boundaries of the ischiorectal space. Got it? The boundaries of the ischiorectal space. And one more point about this. So just get me the pelvis there. So think this is the rectum and anal canal. Okay? So this is the pelvis. The rectum and anal canal pass through like this. Okay, make it small. Okay? So here is the rectum and anal canal. So now on either side, this is the space, ischiorectal space. This is the ischiorectal space. Okay? So anteriorly you have the perineal membrane here, like this. Clear? Posteriorly what you have? You have the ischial tuberosity and the sacrum. Between them is the ligament. Sacrotuberous ligament posteriorly. Clear? Laterally, this is the lateral boundary formed by ischium, where you have ischium tuberosity and ischial spine. Clear? So here what muscle you find? Lateral wall of the pelvis? Obturator internus. So medially the rectum and anal canal. Got it? So above you have pelvic diaphragm like this. Okay, so now you got understood the boundaries of the ischiorectal space, this space and this space, right side. So now the rectum and anal canal are in the center like this. There is a communication between right and left ischiorectal fossa. This is the okay, rectum and anal canal. Now this space behind this. So the right ischial fossa, ischiorectal fossa is communicating posterior to the rectum and anal canal with the left in the form of horseshoe. You know, this is left ischiorectal fossa, this is right ischiorectal fossa. Here you have the rectum. So posterior to the rectum you have communication. Understood? So that's how right and left ischiorectal fossas are continuous each other in a horseshoe manner. Horseshoe is like this, right? Horseshoe, U shape. Okay. So that is the boundaries of the ischiorectal fossa and its position. Now coming to, so there is one more picture again showing you the boundaries. Okay. So now the same boundaries what I explained till now. Now the recesses, as I explained, there are two main recesses. One is the anterior recess. What is the recess? If we consider this as a space, okay. So there is outpoaching of this space. So like this, it extends anteriorly, it extends posteriorly. Recess, understood?
Yes.
So recess anteriorly, this ischiorectal fossa may extend up behind the pubic bones. That is called as anterior recess. Whereas posteriorly it may extend beyond this ischiorectal, sacrotuberous ligament. So that is the posterior recess, even between below the your gluteus maximus muscle. Here you have the gluteus maximus muscle.
Yes.
These are the ligaments. It may extend beyond that. So that is the posterior recess. Am I clear? And one more recess, as I explained, the horseshoe recess, communicating left to the right. So these are the recesses of the ischiorectal fossa of the space. Now coming to contents. So contents here. So what are the contents? Number one.
Fat.
So the main content of the ischiorectal space is
Fat.
ischiorectal pad of fat, which is loosely lobulated, loosely packed space. Okay, fat. And then you have the inferior rectal nerves and vessels. Okay, inferior rectal nerves and vessels which are supplying the rectum and anal canal from inside. Okay, which pass through this space, these nerves. And then you have the posterior scrotal labial nerves and vessels which supply your scrotum and labia major in case of females. Okay, and then you have the very important content is the pudendal canal. What is that? Pudendal canal. So in this space, on the lateral wall of the ischiorectal space, you find this space. canal line. Got it? So before that, let me explain this fascias covering it. So this is ischium bone. Agreed? Okay.
Yes,
Next to that, what is this muscle? Obturator internus muscle. And covering this fascia, obturator internus fascia. Agreed? Okay. Next to that fascia, there is one more fascia which is going up like this. Am I clear? So this is fascia, what we call it as lunate fascia. What is that called as? Lunate, because of its half moon shaped like this. Okay. So this fascia covers the obturator fascia, runs upwards and fuses with this pelvic fascia. Are you followed? Lunate fascia,
Okay.
Lunate, which is there inner to obturator fascia. This is obturator internus muscle. Covering it is obturator fascia. Agreed? So inner to this obturator fascia, there is one more fascia running up. So that is called as the lunate fascia, which covers obturator internus fascia, runs up and fuses with the pelvic diaphragm. And even it is covering the lateral wall of the, or the walls of the anal canal, or covering the sphincters. This is what is lunate fascia. So this fascia divides this space into a bigger
And
infrategmental space, we say, and this space above this fascia, very little space near the apex. This is called as suprategmental space. So lunate fascia divides the ischiorectal space into two compartments. What are they? Suprategmental space and then infrategmental space. Okay?
Okay.
But truly ischiorectal space means it is the infrategmental, which is big. Am I clear? So now this lunate fascia, in the lower part it is splitting.
Do you think?
Yeah? Splitting and then fuses with the obturator fascia again. Okay? So now in between the two split fascias of the lunate, so you have the canal.
Do you think?
It is called as
Pudendal.
Pudendal Canal. What is that canal? Pudendal Canal. So Pudendal Canal, how is it formed? It is found by the splitting of the
Lunate fascia.
lunate fascia. So this is the Pudendal Canal. Where it is there? It is there on the lateral wall, close to the ischial spine.
Okay.
Ischial spine. Okay. So it extends even to the ischio tuberosity also. Okay. Where you have the vessels and nerves in that canal. What is that vessels and nerves? Just like obturator canal. It's coming out through obturator foramen. Here it is Pudendal Canal. So this Pudendal Canal contains internal pudendal vessels. What it contain? Internal pudendal vessels. Vessels means what? Artery and vein. Internal pudendal artery and internal pudendal vein and internal pudendal nerve. So what are the contents of the Pudendal Canal?
Within the vessels and
Internal
within the
pudendal vessels and internal pudendal nerve. So which are, as I explained in the previous classes, they are the vessels and nerves of the perineum. Perineum. What is the artery of the pelvis? Internal iliac artery. Internal iliac artery is the artery of the pelvis, but the internal pudendal is the artery of the perineum. Clear? So that is the Pudendal Canal forming one of the content of the ischiorectal space. Okay? So then you have, then you have perineal branch of the fourth sacral nerve and perforating cutaneous branches of S2 and S3. So they all form the contents of ischiorectal space. So repeat again. Ischiorectal, bad of fat, then inferior rectal nerves and vessels, posterior scrotal or labial nerves and vessels, Pudendal Canal and its contents, that is internal pudendal vessels and internal pudendal nerve, and then perineal branch of fourth sacral nerve. So you can remember like S2, S3, S4.
Okay.
S2, S3, S4.
S4,
Okay. So they all form the content of ischiorectal space. Ischiorectal
Space.
Okay. So that is again same as I explained the lunate phase. Okay. So as I said, it arches over the ischiorectal fat, begins laterally at the Pudendal Canal, or you may say it splits to form the Pudendal Canal. Okay. Medially with the facial covering of the external anal sphincter and all. So this is about the Pudendal Canal. Okay. So now coming to, that's about the ischiorectal space.
Okay.
So anatomy of the ischiorectal space. So what I explained its position, and then explained about the boundaries, then explained about the contents.
Okay.
So now its clinical importance. As I already explained you, this is the picture showing. See there? So this is the anal orifice, right? So here this part of the skin is red. Why it is red? Because there is abscess. There is abscess inside. The space is having abscess. So now the ischiorectal abscess, they are less painful compared to other abscesses in the body. Why they are less painful? Anyone?
Less nerve supply.
and
Not less nerve supply.
less
Because the space is big. The space, when there is pain, why the infections on the nose, the ear lobule, they are very painful?
Short surface diameter.
Yeah, you are right, nearer. So because the skin is tightly adherent to the underlying cartilages. Whenever there is abscess here, small abscess, so there is no space for the expansion. The pressure, tension builds up. That's why it will irritate more nerve endings. Whereas this space is a large space containing fat. There is more space for accumulation of the abscess. So there is no tension. There is no much pressure within the abscess. That's why they are less painful, unless it involves the hair follicle. When it is involving the hair follicle, they are very painful. Why? Because the hair follicle, you have many nerve endings, which will irritate the many nerve endings. Okay? So that's why they are less painful. So the patient will neglect it and come with large abscesses, a very big abscess. Then only he will have pain, fever and all. Then he comes to the doctor. By that time, it might have ruptured into the anal canal, forming fistula. So that's why fistulas are common. Why? He neglects. The abscess becomes large and large. And then one day finally it breaks down into the anal orifice, or it breaks down through the skin surface, forming fistulas. Clear?
Yes.
So the ischiorectal space abscesses are very common, especially in people who are driving for long distance, like the truck drivers who carry goods from one place to other, like from Riyadh to here. Also, he has to come. He has to drive the truck continuously for 10 to 12 hours. Okay, continuously sitting on the seat. So what happens? Continuous friction between his ass and seat. So what happens? The temperature rises between his ass and this, and then the skin becomes very soft, and there are a lot of hairs also there. Okay, the hairs will prick. Okay, and then there may be there is beginning infection of the hair follicle, and then it spreads and then forms the abscess. And even if they don't keep along with that, one more contributing factor is not keeping the area hygienic, clean. Okay, so what happens? There are already bacteria, there is slight irritation. Okay, then suddenly the infection spreads and then forms the abscess in the ischiorectal space. Clear? So they are common. So that is one of the clinical importance. And next very important one is about the Pudendal Canal. So this is the nerve which supplies much of the perineum. Many of its branches will supply the perineal area. So when a mother goes to the delivery, after pregnancy, the full-term mother goes to the hospital for delivery, especially the primates. Okay, so where the vaginal orifice is tight. Okay, so the baby's head cannot pass through the birth canal easily. So what happens? Because of the smaller orifice, or the vaginal orifice. So what happens? There may be chances of tearing of the perineum. So the baby, so she puts up more pressure. So what happens? It will pass through the orifice, cutting the perineum between the anus and the vagina. The skin, whatever is there, it tears, and it becomes the very big, and then there may be chance of prolapse of the uterus. Prolapse of the uterus through that big uterus opening. So to prevent that, what the doctor does, he does a procedure called as episiotomy. He cuts the skin of the perineum on the sides. Okay, so that baby's head can pass easily. So that procedure is called as episiotomy. What is it called as? Episiotomy. Usually it is done in primates. Okay, for the easy passage of the baby. Normal delivery, I'm talking. So to cut that skin, she has to be anesthetized that area. So then what is the nerve which supplies? Is the pudendal nerve. So you have to block the pudendal nerve to anesthetize that area. So you have to block means just like when you go to dentist. So he will give injections here. Which nerve he will block?
Maxillary.
The lingual nerve or the inferior alveolar nerve. You will block, okay, to prevent the pain for you when you are doing the procedures. Okay. So So what he will do? He will do injection directly to the nerve. Okay. Just where is the lingual nerve situated? Last molar, right? So just adjacent to the last molar. You will put one finger there, take the needle syringe and then inject there. Okay, or at the region of the mandibular foramen to block the inferior alveolar nerve. Clear? Here what happen? He will do? He will palpate the ischial spine. Ischial spine. So he will palpate the ischial spine and then take a syringe and inject the anesthetic agent at the ischial spine, so that he will be blocking the pudendal nerve. Pudendal nerve. So then see all the area, perineal area is anesthetized. Then he can cut and then later he can suture it. Clear? So that's why the ischial spine becomes the guiding to block the landmark to block the pudendal nerve. So that procedure is called as pudendal block. So give pudendal block means he has to locate the ischial spine, then take a syringe and then give the injection there. Clear? That procedure is called as pudendal block. So what is the landmark to give the pudendal block? Ischial spine. Ischial spine. Am I clear? Yes. So that is about the pudendal block. And one more point. So here he has come with the abscess. Okay. So now you have to drain the abscess. So you have to give incisions like in this way, the longitudinal incisions or the horizontal incisions. So depending on the size of the abscess. Only one thing what you have to take care is you have to prevent injury to the inferior rectal nerves and vessels which are running across the space. Okay, if you go very deep, then you may be having chance to cutting these nerves. Okay, so while draining the abscess of the ischiorectal space, you have to take care not to injure which nerves? Inferior rectal nerves. So which will be supplying the sphincters, the anal sphincters. So if you cut that nerve, incontinence, that stools will be passing. Incontinence will drain. So while draining the abscess of the ischiorectal space, you must take care not to injure the inferior rectal nerves and vessels. Clear? So and even putting the incision also is not much painful to the, and even it's not so dangerous compared to other spaces because there is less poorly blood supply. Okay, so even there are not much blood vessels. Even if you take a long incision, there won't be much bleeding compared to other areas. Got it? So there is no much adverse effects or the more bleeding compared to other abscess drainage. Okay, because you have very less blood supply to this space. Clear? So that's all about the ischiorectal space about the today's class. As you can see the abscesses. So that is about the pudendal block what I explained. The pudendal nerve is infiltrated with local anesthetic solution where it crosses the ischial spine. So that's all. This is the last slide. Giving you the summary of the class. Clear? So that's all about the ischioanal or ischiorectal fossa or space. Thank you. So any doubts?
About the hospital.
Pictures, one or two. That's this one picture. Okay. The same. This is the one. Second one. It's almost same there. Okay. Those two pictures will happen.
How can I be asked about it?
I said no. How can you ask me what? Identify. So like that, there is space. What I mark. So what is that space? So like this space. I mark A or B. What is this space? Marked space or A space marked as A. The second question will be what are its boundaries maybe, what are its contents maybe, or maybe this. What is this? So we will write as Pudendal Canal. So what are its contents? Are structures present in it? Like that. I'm asking any questions like that. First question will be from the picture. Second question, succeeding question will be anything can be asked from the lecture, what I explained.
Okay, thank you.